Hey everyone, and welcome back to the channel. Have you ever thought about what getting older in America really looks like? I don't mean just retiring and relaxing. I mean the real day-to-day stuff, especially when it comes to health. We often hear the term silver tsunami. But what does that actually mean for our parents, our grandparents, and eventually for us? Today we're taking a deep dive into the complex world of elderly care in the United States, a topic that affects millions of families every single day. Let's start with a staggering fact from the US Census Bureau. By 2034, older adults are projected to outnumber children for the first time in US history. That's a massive demographic shift. The question is, as a nation, are we truly prepared to provide the healthcare this growing population needs? The reality is, navigating the system can feel like trying to solve a puzzle with half the pieces missing. From finding the right doctors to managing multiple medications and dealing with insurance, the journey can be overwhelming for both seniors and their families. One of the biggest hurdles is the prevalence of chronic conditions. According to the National Institute on Aging, or NIA, about 85% of older adults have at least one chronic health condition, and 60% have at least two. We're talking about things like heart disease, diabetes, arthritis, and dementia. These aren't one-time illnesses. They require constant ongoing management. This means frequent doctor visits, multiple prescriptions, and lifestyle adjustments. For a family caregiver, it can feel like a full-time job, trying to coordinate appointments, track medications, and ensure their loved one is following their treatment plan. And that brings us to the elephant in the room, the cost. The financial burden of aging is a hidden crisis for many American families. According to reports from America's health rankings, healthcare expenses are a significant source of stress for seniors. Even with Medicare, out-of-pocket costs for prescription drugs, specialized care, and long-term support services can be astronomical. Think about it. A stay in a skilled nursing facility can cost thousands of dollars a month. Many families find themselves draining their life savings to cover these expenses, creating a ripple effect of financial strain across generations. The National Council on Aging, or NCOA, highlights that millions of older adults are economically insecure, forced to choose between paying for medicine, food, or rent. So where's the hope? The good news is that we're not just standing by. There's a powerful movement to rethink elderly health, focusing on innovative solutions. One of the most promising areas is the shift towards age-friendly health systems. The American Geriatric Society, or AGS, is a huge proponent of this, emphasizing what's known as the 4 M's of geriatric care. What matters: medication, mentation, and mobility. This framework encourages doctors to focus on the patient's personal goals, simplify medication regimens to avoid harmful side effects, proactively check for cognitive issues like dementia and depression, and help seniors maintain their mobility and independence. It's a move from just treating diseases to caring for the whole person. Technology is also playing a huge role. Telehealth has become a game changer, allowing seniors in rural or underserved areas to connect with specialists without the difficulty of travel. Wearable devices can monitor vital signs and detect falls, providing peace of mind for both the senior and their family. There are even apps that help manage medications and coordinate care schedules among family members. These aren't just gadgets. They are tools that empower seniors to live more safely and independently in their own homes, which is what most people want. This concept, known as aging in place, is a central focus for organizations like the American Society on Aging. Of course, caregivers are the unsung heroes in this story. They are the backbone of our long-term care system. The Centers for Disease Control and Prevention, the CDC, recognizes that caregiving can take a significant toll on a person's physical and mental health. The stress, the long hours, the emotional weight, it's immense. That's why support for caregivers is so critical. This includes access to respite care, which gives them a much-needed break, as well as support groups and educational resources to help them navigate the challenges. If you're a caregiver, please know that your health matters too. Reaching out for help isn't a sign of weakness, it's a sign of strength. The Health in Aging Foundation provides fantastic resources for caregivers, and I highly recommend checking them out. So what can we do? On a personal level, it starts with conversation. Talk to your aging parents or loved ones about their wishes for future care. It can be a tough conversation, but it's one of the most important you'll ever have. Understand their financial situation and help them explore their options for long-term care insurance or other resources. On a societal level, we need to advocate for policies that support seniors and their caregivers. This means expanding access to affordable home care, making prescription drugs more affordable, and investing in geriatric training for more healthcare professionals. We need to build communities that are truly age-friendly, with accessible transportation, safe housing, and opportunities for social engagement. The challenges of elderly healthcare in America are complex, but they are not insurmountable. By combining compassionate, person-centered care with innovative technology and robust support for families, we can create a future where aging is not a crisis, but a respected and supported stage of life. It's about ensuring dignity, independence, and quality of life for the people who have contributed so much to our world. Thank you so much for joining me for this important discussion today. If this topic resonated with you, or if you have your own experiences to share, please leave a comment below. I read every single one. And if you found this video helpful, please give it a thumbs up and consider subscribing for more content that matters. Stay safe, stay informed, and I'll see you in the next video.